stepping into a hot shower first thing in the morning and suddenly you feel dizzy, your heart starts racing, and before you know it, you're grabbing onto the wall trying not to fall. This happens to thousands of American seniors every single day, and most people have no idea they're putting themselves at serious risk every time they turn on that shower. What I'm about to share with you could literally save your life, because these shower habits that seem completely harmless are actually triggering heart attacks and strokes in bathrooms across America, and the worst part is that 90% of these incidents are completely preventable if you just know what to avoid. My name is Dr. Rebecca Parker. I've worked as a physician for over 20 years, and today I focus specifically on senior health. And I need to tell you something that might shock you. Your bathroom could be one of the most dangerous rooms in your house, not because of falls or slips, but because of what happens to your cardiovascular system when you shower the wrong way. You're not alone in this. Right now, as I'm speaking to you, someone somewhere in America is having a cardiac event in their shower, and they had no warning, no chest pain beforehand, nothing that told them today would be different from any other day. But their body was being pushed to a breaking point by habits they thought were perfectly normal and safe. Let me explain what's really happening inside your body when you step into that shower, because understanding this could be the difference between life and death. Your cardiovascular system, especially as we get older, becomes more sensitive to sudden changes in temperature and pressure. When you expose yourself to extreme heat or cold water without proper preparation, your blood vessels react violently, and I mean violently in ways that can trigger catastrophic events. Think about it this way. Your blood vessels are like highways for your blood, and when you suddenly blast them with hot water, those highways either expand too quickly or contract too fast, depending on the temperature. And this creates a massive strain on your heart, which has to work overtime to pump blood through these rapidly changing pathways. For seniors with any existing cardiovascular condition, even if you don't know you have one, this can be the trigger that sets off a heart attack or a stroke. According to recent studies, bathroom-related cardiac events have increased by 37% among Americans over 65 in the last decade, and researchers have identified specific shower habits as major contributing factors. The statistics are alarming. Every year, more than 40,000 seniors experience serious cardiovascular events while bathing, and the tragedy is that most of these could have been avoided with simple changes to their routine. Let me tell you about one of my patients, a 72-year-old man from Ohio named Robert. Robert was healthy, active, went fishing every weekend, took care of his grandchildren, and had what seemed like perfect morning routines. Every single day for 20 years, he would wake up, go straight to the bathroom, turn the shower on as hot as it would go, and step right in. He loved that feeling of hot water hitting his skin first thing in the morning because it woke him up and made him feel energized for the day ahead. One Tuesday morning in February, during one of those harsh Midwestern winters, Robert did exactly what he always did. But this time, within 30 seconds of stepping into that scalding hot shower, his blood pressure spiked so dramatically that it triggered a massive stroke. His wife found him collapsed in the bathtub 20 minutes later. Robert survived, but he lost mobility on his entire left side, and his life changed forever because of a shower habit he thought was completely harmless. This is not meant to scare you, but to wake you up to a reality that most doctors don't talk about enough. Your morning shower routine could be putting your life at risk, and the longer you wait to change these habits, the more you're playing Russian roulette with your cardiovascular health. If this is resonating with you, if you've ever felt dizzy or lightheaded in the shower, hit that like button right now, because this information needs to reach every senior in America who's unknowingly putting themselves in danger every single day. Now let me break down the most dangerous shower habits that are causing these preventable heart attacks and strokes, and more importantly, I'm going to give you 3 powerful solutions that will protect your heart and brain while you bathe. The first deadly habit that I see constantly is what I call the temperature shock entry, and this is exactly what Robert was doing. This happens when you go from a cool or normal room temperature directly into extremely hot water without any transition period. From a medical perspective, here's what's happening in your body. When hot water suddenly hits your skin, your peripheral blood vessels dilate rapidly to release heat, which means your blood pressure can drop suddenly. But at the same time, your heart rate increases dramatically to compensate, and this combination puts enormous stress on your cardiovascular system. For seniors, especially those with any degree of arterial stiffness, which happens naturally as we age, this sudden change can cause what we call a vasovagal response, where your blood pressure drops so fast that you lose consciousness. Or it can trigger a hypertensive crisis where your blood pressure spikes dangerously high. Either scenario can lead directly to heart attack or stroke, and it happens faster than you can react. The second dangerous habit is showering immediately after waking up without giving your body time to fully activate. During sleep, your blood pressure naturally drops, your heart rate slows down, and your entire cardiovascular system is in what we call a rest state. When you jump straight from bed into a hot shower, you're forcing your system to go from 0 to 60 in seconds, and your heart simply isn't ready for that kind of demand. Research indicates that the first hour after waking is already the highest risk period for cardiac events because your body is transitioning from sleep to wake mode, and when you add the stress of temperature changes from showering, you're multiplying that risk exponentially. Doctors explain that your blood becomes slightly thicker during sleep due to dehydration, and your blood vessels are more constricted. So sudden heat exposure combined with this state creates the perfect storm for a cardiovascular event. The third habit that's incredibly dangerous is taking very long hot showers, especially in small bathrooms with poor ventilation. What happens here is that the steam and heat build up, creating a sauna-like environment, and while that might feel relaxing, it's actually causing your body temperature to rise significantly, which forces your heart to work much harder to cool you down. In enclosed spaces, this can lead to overheating, dehydration, and dangerous drops in blood pressure that can cause you to faint and fall or trigger cardiac events. I remember a patient, a 68-year-old woman from Florida named Margaret, who loved taking long hot showers every morning for 30 to 40 minutes because she said it helped with her arthritis pain. What Margaret didn't realize was that every single day she was putting herself at risk. One morning, about 25 minutes into her shower, she felt suddenly weak, dizzy, and nauseous. She tried to turn off the water, but collapsed before she could reach the faucet. Fortunately, her husband was home and found her quickly, and she recovered, but the emergency room doctor told her that she had experienced a severe drop in blood pressure combined with dehydration that nearly caused her heart to stop. These stories are not rare exceptions. They're happening every single day in homes from California to New York, from Texas to Michigan, and most people have no idea they're at risk until it's too late. Now here's what you need to understand. Your body is not the same as it was when you were 30 or 40 years old. Your cardiovascular system has changed. Your blood vessels have lost some of their elasticity. Your heart has to work harder to do the same job it used to do effortlessly. And these changes mean that habits that were perfectly safe for you decades ago can now be life-threatening. But here's the good news, and I want you to really hear this. You don't have to live in fear of your shower. You can absolutely continue to enjoy bathing safely and comfortably. You just need to make some simple adjustments that will protect your heart and brain while you do it. Let me give you the first solution, and this is something everyone can do starting today without spending a single dollar. It's what I call the gradual temperature transition method, and it's probably the single most important change you can make to protect yourself. Here's how it works. Before you step into the shower, turn the water on at a lukewarm or slightly warm temperature, not hot, just comfortable. Let it run for about 30 seconds so the bathroom starts to warm up gradually and you can adjust to the idea of getting wet. Then step into this lukewarm water and let your body adjust for at least 30 to 60 seconds before you even think about turning up the heat. The science behind this is simple but powerful. By allowing your blood vessels to adjust gradually to temperature changes, you prevent that violent dilation or constriction that puts stress on your heart. Your cardiovascular system has time to respond appropriately, your blood pressure remains stable, and your heart rate increases naturally rather than spiking suddenly. After you've been in the lukewarm water for a minute or so, you can gradually increase the temperature to your preferred warmth, but do it slowly over another 30 to 60 seconds. This gradual approach gives your body the time it needs to adapt safely, and it completely eliminates the shock factor that causes most shower-related cardiac events. Many of my patients tell me that once they started using this method, not only did they feel safer, but they actually enjoyed their showers more because they didn't experience that initial shock or discomfort of sudden temperature changes. And they felt more alert and energized afterward rather than dizzy or lightheaded. The second part of this first solution is equally important. Never end your shower with very hot water. When you're ready to finish, gradually reduce the water temperature back down to lukewarm or even slightly cool over the last minute or two of your shower. This helps your blood vessels return to normal gradually and prevents the dizziness that many people experience when stepping out of a hot shower into cooler air. Think of it this way. You're treating your cardiovascular system with the same gentle care you would treat a delicate piece of equipment, because that's exactly what it is. Your heart and blood vessels need gradual transitions, not sudden shocks, and this simple habit change can literally save your life. If you want access to exclusive content, deeper protocols, and personalized advice on protecting your cardiovascular health, become a channel member. There I share even more detailed information about senior health that I can't cover in regular videos. Now let me give you a simple protocol that you can implement immediately, and I want you to write this down or remember it because this is your new shower safety routine. Simple shower safety protocol. Before showering, drink a full glass of water, about 8 ounces, at least 15 to 20 minutes before you plan to shower. This ensures you're well hydrated and your blood volume is optimal, which helps maintain stable blood pressure during temperature changes. Timing. Wait at least 30 to 45 minutes after waking up before you shower. Use this time to move around gently, maybe have a light breakfast or some fruit. Let your body fully wake up and your cardiovascular system stabilize from sleep mode. Temperature start. Begin with lukewarm water, around 75 to 80 degrees Fahrenheit, which should feel slightly warm but not hot when you test it with your hand. Transition time. Spend 1 full minute in this lukewarm water before gradually increasing temperature. Increase the heat slowly over another minute until you reach your comfortable warm temperature, which should never exceed 100 to 104 degrees Fahrenheit. Shower duration. Keep your total shower time under 15 minutes and ideally between 8 to 12 minutes. This prevents overheating and excessive steam buildup. Cooling down. In the last 2 minutes of your shower, gradually reduce the water temperature back to lukewarm. This prepares your body for the temperature change when you step out. Ventilation. Always shower with the bathroom door slightly open or the ventilation fan running to prevent steam and heat buildup. Good air circulation is crucial for preventing overheating. This protocol is simple, it's free, it's easy to implement, and it addresses the fundamental problem of temperature shock that causes the majority of shower-related cardiac events. But that's not all, because while temperature management is crucial, there are other factors we need to address to make your bathing completely safe. And that brings me to the second solution, which is even more powerful when combined with the first one. The second solution focuses on what I call pre-shower cardiovascular preparation, and this involves preparing your body specifically for the physical demands of showering. Remember, showering isn't just about getting clean. It's actually a physical activity that requires your cardiovascular system to work. And like any physical activity, your body performs better and more safely when it's properly prepared. Here's what you need to do. Before you even turn on the water, spend 3 to 5 minutes doing very gentle movement to wake up your cardiovascular system. This doesn't mean exercise or anything strenuous. It simply means light activity that gets your blood flowing and your heart rate up slightly from its resting state. Some examples that work perfectly: walk around your house for a few minutes, do some gentle arm circles while standing, march in place slowly for a minute or two, or do some light stretching. The goal is to transition your body from rest mode to active mode gradually rather than forcing it to make that jump instantly when hot water hits your skin. From a medical perspective, what you're doing is allowing your heart rate to increase naturally, encouraging blood flow to your extremities, and warming up your muscles and blood vessels so they're more responsive and flexible when you step into the shower. This dramatically reduces the risk of sudden blood pressure changes and cardiac stress. I had a patient, a 75-year-old man from Pennsylvania named James, who used to feel dizzy and weak every time he showered. He was actually starting to avoid showering regularly because he was afraid of falling, which created other health and hygiene issues. When I taught him this pre-shower preparation routine, he was skeptical at first, but he tried it anyway. Within 1 week, James reported that he no longer felt dizzy during or after showers. Within a month, he told me with tears in his eyes that showering had gone from being something he feared to something he enjoyed again, and he felt more confident and independent because he wasn't worried about collapsing in the bathroom anymore. That's the power of simple preparation. The second part of this solution involves post-shower recovery, which is just as important as preparation. After you finish your shower and dry off, don't immediately rush into your day. Sit down for 3 to 5 minutes, preferably on your bed or a chair in your bedroom, and let your body fully stabilize before you start getting dressed or moving around actively. This sitting period allows your blood pressure to normalize, your body temperature to regulate back to normal, and your cardiovascular system to transition from the stress of showering back to a calm resting state. Many seniors skip this step, and that's when they experience falls or fainting episodes right after showering, even though they felt fine during the shower itself. During this recovery time, you can also drink another glass of water to replace any fluids you lost through sweating in the warm shower. Hydration is absolutely critical for seniors because as we age, our sense of thirst decreases and we can become dehydrated without even realizing it, which makes us much more vulnerable to blood pressure problems and cardiac events. Write in the comments, have you ever felt dizzy or lightheaded during or after a shower? Share your experience because your story could help other seniors realize they're not alone and motivate them to make these important changes. Now let's talk about the third and most comprehensive solution, and this one brings everything together in a way that not only protects you from shower-related cardiac events, but actually improves your overall cardiovascular health at the same time. The third solution is what I call cardiovascular strengthening through water therapy, and it involves using your shower as a tool to actually make your cardiovascular system stronger and more resilient over time. This might sound counterintuitive after everything I've said about the dangers of showering, but when done correctly and safely, controlled temperature variations in the shower can actually train your blood vessels to be more flexible and responsive, which reduces your risk of heart attacks and strokes in all situations, not just in the bathroom. This technique is based on a practice that's been used in Northern European countries for decades, where they alternate between warm and cool water in a very controlled, gradual way. The key word here is controlled, because we're not talking about jumping between extremes. We're talking about gentle, progressive changes that challenge your cardiovascular system just enough to make it adapt and strengthen without ever putting you in danger. Here's how it works, and please pay close attention to the specific instructions because doing this incorrectly could be dangerous, but doing it right can be transformative for your cardiovascular health. Start with your normal lukewarm shower entry that I described in the first solution. Spend 2 to 3 minutes in comfortably warm water, letting your body fully adjust. Then, and only after you're completely comfortable and relaxed, reduce the water temperature slightly. Just enough that you notice it's cooler, but it's not uncomfortable or shocking. Stay in this slightly cooler water for 30 to 60 seconds. Then gradually increase the temperature back to warm. Again, not hot, just comfortably warm, and stay there for 1 to 2 minutes. After this, reduce the temperature again to slightly cool, a bit cooler than the first time, but still not cold or uncomfortable, and hold for another 30 to 60 seconds. You repeat this pattern 2 to 3 times during your shower. Warm for 1 to 2 minutes, cool for 30 to 60 seconds, warm for 1 to 2 minutes, cool for 30 to 60 seconds. Always end on warm temperature so your body isn't shocked by cold when you finish, and then follow the gradual cooling protocol I mentioned earlier before you step out. What's happening scientifically is that these gentle temperature variations are exercising your blood vessels. When the water gets cooler, your blood vessels constrict slightly to preserve heat. When it gets warmer, they dilate to release heat. By doing this in a controlled, gradual way, you're training your blood vessels to be more elastic and responsive, which means they're better able to handle temperature and pressure changes in everyday life. According to recent studies from cardiovascular researchers in Scandinavia, seniors who practiced this type of controlled water therapy showed significant improvements in blood vessel flexibility, better blood pressure regulation, and reduced risk of cardiac events compared to those who didn't. The improvement was measurable within just 4 to 6 weeks of consistent practice. But here's the critical part. This technique is only safe if you follow the gradual approach exactly as I described. Never use very hot or very cold water, never make sudden temperature changes, and never do this if you have uncontrolled high blood pressure, recent heart surgery, or active heart disease without first consulting your doctor. For most seniors, this is perfectly safe and highly beneficial, but individual medical conditions can vary, so professional guidance is important. I remember a patient, a 70-year-old woman from California named Patricia, who came to me complaining of frequent episodes of dizziness and what she called mini dizzy spells throughout the day, not just in the shower but while walking, standing up from a chair, or even just turning her head quickly. After ruling out serious medical conditions, I taught her this water therapy technique as part of a comprehensive cardiovascular strengthening program. Patricia was diligent and consistent. She practiced the controlled temperature variations in her shower every single morning for 8 weeks, and she also followed the pre-shower preparation and post-shower recovery protocols I mentioned earlier. The results were remarkable. Her dizzy spells decreased by about 80% within the first month, and by the end of 2 months, they were almost completely gone. Her blood pressure became more stable, she felt more energetic, and she reported feeling more confident and less afraid of sudden fainting or falling. But the most powerful part of this third solution is that it works synergistically with the first 2 solutions. When you combine gradual temperature transitions, proper preparation and recovery, and cardiovascular strengthening through water therapy, you create a comprehensive approach that doesn't just prevent shower-related heart attacks and strokes. It actually makes your entire cardiovascular system healthier and more resilient. Think about it this way. Instead of your shower being a daily risk to your health, it becomes a daily opportunity to strengthen your heart and blood vessels. You transform a dangerous habit into a healing practice, and that's incredibly empowering, especially for seniors who often feel like their bodies are working against them rather than for them. If this video has opened your eyes to the real dangers of improper showering habits and given you practical solutions you can implement immediately, hit that like button because this information could save lives and it needs to reach as many seniors as possible. Now let me bring all of this together for you so you have a clear, complete picture of how to protect yourself and even improve your cardiovascular health every time you bathe. The 3 solutions work together like this. Solution 1 gives you the foundation of safety through gradual temperature transitions and proper shower protocol. This alone will eliminate the majority of your risk for shower-related cardiac events. Solution 2 adds preparation and recovery, which ensures your body is ready for showering and properly stabilized afterward. This further reduces your risk and also helps prevent falls and fainting episodes. Solution 3, when you're ready and medically cleared, adds cardiovascular strengthening that makes your entire system more resilient and healthy over time. You don't have to implement all 3 solutions at once. Start with Solution 1 immediately because it's simple, safe, and highly effective. Once you're comfortable with that and it's become a natural habit, add Solution 2. Then, if you're interested and your doctor approves, you can explore Solution 3 as a way to actively improve your cardiovascular health rather than just protecting it. The key is consistency. These solutions only work if you actually use them every single time you shower, not just occasionally or when you remember. Make them part of your daily routine, just like brushing your teeth or taking your medications. Your cardiovascular health depends on it, and the beautiful thing is that once these become habits, you won't even have to think about them anymore. They'll just be the natural way you shower. Let me also address something important. Some of you might be thinking, I've been showering the same way for 50 or 60 years, and I've never had a problem, so why should I change now? And I understand that perspective, but here's the reality. Your cardiovascular system today is not the same as it was even 5 years ago. Aging changes everything, and habits that were perfectly safe when you were younger can become dangerous as your blood vessels stiffen, your heart works harder, and your blood pressure becomes less stable. The fact that you haven't had a problem yet doesn't mean you won't have one tomorrow, and the tragedy would be experiencing a preventable heart attack or stroke when simple changes could have protected you. Prevention is always better than treatment, and in the case of cardiac events, prevention could mean the difference between life and death or between independence and disability. I also want you to understand that these shower habits I've described are not just theoretical risks. They're causing real harm to real people every single day. The emergency rooms across America see shower-related cardiac events constantly, and most of those patients had no idea they were at risk. Don't let yourself become one of those statistics when you have the knowledge and the tools to protect yourself right now.